Today's topic will be shoulders. Shoulder anatomy, shoulder pathology, meaning the diseases that can affect the shoulder, and how Dr. Singh manages these pathologies. So let's start off by telling us a little bit about normal shoulder anatomy, and then we'll get in deeper from there.
Absolutely. So the shoulder, just by default, people think is just one joint, but really what it is a conglomerate of the ball and socket that everybody agrees is the shoulder joint, but there's one more joint above it. We call that the acromioclavicular joint. There's a joint behind, which is the scapula, and then, believe it or not, even the joint that comes and connects to the neck area, called the sternal joint that goes with the clavicle, that also. So all four joints, believe it or not, make the shoulder, and we have our expertise on the whole four joints, but mainly, like you said, the ball and socket joint off the upper extremity is what we call the shoulder joint.